Welcome to Billings Clinic Health Magazine. I'm Leslie Blair, and joining me today is Dr. Dennis O'Brien, a neurologist with the Billings Clinic. We are going to be talking about migraines, and as many of you may know, they can be very debilitating. Stay tuned. Welcome, Dr. O'Brien.
Good morning. Thank you for having me.
Glad to have you. It's important to talk to an expert about migraines. I know that's probably what you studied in school.
Yes, ma'am.
Dr. O'Brien, how long have you been with the clinic?
Since 2007.
Okay, so you're coming up on 10 years here pretty soon.
Yeah, pretty
One more
close.
year.
Yeah.
That's awesome. Well, we're lucky to have a fellow like you on our staff.
Thank you.
Neurology is the study of
The brain, the spinal cord, which is the big cable that goes down your back, the cable of nerves, and the nerves that come out of the spinal cord going to our hands and feet.
And unfortunately, there are a lot of disorders and diseases that can affect all of that.
A surprising number, yes.
Well, today we're going to talk about migraines, and I know that lots of people are going to be interested in this topic because many people and loved ones are impacted by and affected by migraines. So can you tell us, what is a migraine?
A migraine is actually a transient, that means hopefully short-lived, episode of brain dysfunction. And there are several hormones involved, the main one being serotonin. And we used to think that migraines were limited to the blood vessels in your brain and increased blood flow to your brain, but now we know that that's not necessarily the case, and it's more of pain mechanisms in those blood vessels as well as in the brain more generally that causes migraine or produces migraines.
Why do some people have migraines and others don't?
Migraines are inherited like your eye color.
Oh my. So if your parents had migraines, that's the kind of inheritance, or your grandmother? Is it that close?
Yes, it's very close. Usually there's at least one other member of the family with migraines as the individual who you're visiting with who's affected. That is, there's almost always other members of the family involved are affected by migraines.
I see. And is there a demographic or age or sex that's more prevalent to migraines?
Women tend to be affected more so than men. That is, if you take 100 people with migraines, a larger percentage of them, or a larger percentage of that number, will be women. The age of onset is anywhere from 10 or early adolescence to usually menopause. The onset of migraines after the age of 40 or 50 without any history at all previously is fairly unusual. Usually it's adolescence in the 20s.
So can people outgrow a migraine or migraines?
In my practice, what I've found is you can suffer from migraines or have them become more problematic at almost any age, and especially in women where the biological landmarks, so to speak, any of them can be associated with an increase in their migraines, like onset of menstruation or childbirth or even menopause can be associated with both an increase in their migraines or a decrease in their migraines.
How many people are impacted by migraines?
Migraines affect 15% of the population, which is a great number of people. And this is not insignificant because there's more lost time from work due to migraines than from strokes.
Oh my gosh. And they're sort of related, aren't they?
Yeah, in a strange kind of way, yes.
Okay, well, I know we're going to talk about that a little bit more. So there is a cost to society for people with migraines, I would assume.
Yeah, they have trouble holding jobs because some employers find it difficult to maintain production if enough of their employees have to go home or stay home because of migraines. So individual with migraines, and we refer to them as migraineurs, actually a lot of them have trouble holding a job because if their migraines are poorly controlled.
I see, I see. There are stages to a migraine. Can you talk about how a person, is there a word like aura? What is the feeling that they're getting a migraine, or what are the stages?
Well, there are 4 phases of a migraine. We don't think about them a whole lot in the clinic, but the 4 stages are a prodrome, which is how somebody feels before their headache, and some folks, about a third of people with migraines have what's called an aura, which we can talk about in a bit. Then the third stage is the headache aspect, which is usually the more debilitating part of the migraine. And then a lot of people feel not quite right for a day or two even, certainly until they get some sleep afterwards, after the headache, and that's called the postdrome. Now the prodrome, which is the first stage, can manifest itself as mood changes and just not feeling quite right. Not really like you have the flu, but not being yourself. Can have some personality changes. That's then the second one is the aura, and the aura is what we call is marked by focal neurologic dysfunction. That is, if I examine somebody while they're having an aura, I might find abnormalities in their neurologic exam. They're usually fairly subtle, but they are certainly detectable. That's followed, the aura can occur before the headache, during the headache, or after the headache. The third phase is the headache, and the characteristics are fairly specific, and we can talk about those in a minute, and followed by the postdrome. And the postdrome can have some fairly subtle aspects. It's, for example, somebody may not feel like they're back to normal. They may have trouble making decisions. They can have some persisting subtle mood or personality changes.
Wow. Now, I think most of us think of migraines as just a headache, and I shouldn't say just a headache. It might be the worst headache you've ever had. So there are other aspects of it that you've just kind of touched on. This feeling that something's not quite right. Describe what kind of mood changes.
Well, some folks can be, usually the mood changes are not desirable, so to speak. Usually somebody's in a bad mood, or they're impatient, or they have an increased sensitivity to light and sound. That's not really debilitating, but definitely there. While we're on that subject, a lot of people with migraines have a constant mild sensitivity to light more so than sound. So folks with migraines, even though they're not having a migraine, can be sensitive to light, and they would prefer not to be in settings that are illuminated by fluorescent lights, and they would far prefer more subdued lighting. And some folks even have to wear sunglasses even when they're inside.
I was just thinking about that, if maybe sunglasses would help.
Yeah. It's not that light seems brighter, it's more like you just cannot tolerate normal intensity of light and sound.
I see. I know we're kind of talking about triggers now. What are some triggers? I mean, does it just happen, or are there things that kind of set off a migraine?
A lot of migraines just kind of happen out of the blue, but migraines are notable for aggravating triggers. And we used to blame food a lot more than we do now, but the more established triggers are lack of sleep or excess sleep. That is, some migraineurs will wake up with a headache if they sleep in. While we're on that subject, migraines are often associated with emotional stress. And at the same time, once that stress is relieved, like studying for an exam, the person can, the next thing they know, they're in the grips of a bad migraine.
Oh.
Alcohol is an established trigger, especially red wines. Some folks blame that on sulfites. That's not proven, as some people will get migraine even though the alcohol beverage is sulfite free. Some prepared foods, that is delicatessen type meat and cheeses, can kick off migraines in some folks. Monosodium glutamate is notorious for being a migraine trigger.
MSG.
And while we're on that subject, aspartame, which is in almost everything in this culture,
Yes.
is a migraine trigger for some people.
Is that in soft drinks?
Yes. Yeah, so if somebody has frequent migraines, one of the first things they should think about is their choice of beverage.
Okay. Now, I have heard that caffeine can sometimes alleviate a headache or migraine.
Yes, many, that's in a favorite over-the-counter formula for migraines, and it's fairly effective. I don't think they know why, but it's in my favorite formula for treating migraines over the counter. At the same time, excess caffeine can, and for everybody it's different, can put somebody at risk for caffeine rebound. Whereas as long as they can maintain their caffeine intake, they're okay. When they're in a circumstance where they can't get to some caffeine, they're going to the likelihood of them having a migraine or a migrainous type headache is fairly high.
What about spicy foods?
That's when it comes to foods, that doesn't have the certainty for causing migraines you used to think it does, and that actually could be part of the aura, is some food craving, and everybody craves their own type of food. But in my experience, and I've suffered from migraine since I was very young, and in talking to patients, if you have noticed that you have a migraine within 24 hours after intake of a certain food substance, well, that food is likely a trigger. But as far as spicy foods, it's kind of idiosyncratic.
Sure. And I'm sure each person is a little different on
Yes, ma'am.
what sets them off. Yeah. I know when we talk about stroke, whenever it is sitting in that chair and we talk about stroke, sometimes we say the worst headache you've ever had may be a symptom of a stroke. What if somebody comes into the emergency room and they've got the worst headache they've ever had? How do they sort out what's what? How do you diagnose this?
Okay, well, what you're talking about is one of the three, is the differential diagnosis, and that is, in medicine, when we get a set of symptoms, we think about a differential diagnosis. It's basically a list that we emotionally generate, like, what could this be? And when you go into the emergency room and you say, this is the worst headache I've ever had, you're alerting the physician who sees you that you could have one of at least three things, two of which are extremely bad, because sometimes it's difficult to distinguish them by history and examination. And one is a migraine. The second one is meningitis, which is an infection affecting the cover of the brain, and which can be deadly. And the stroke component you're talking about refers to what's called a subarachnoid hemorrhage, which is where usually a little defect in an artery in your brain called an aneurysm ruptures and pours blood out in the brain, which can cause strokes in its own way.
Sure.
And therefore, when you go into an emergency room and say, I'm having the worst headache of my life, the primary way they distinguish those is with a lumbar puncture or spinal tap, looking for the characteristic features of subarachnoid hemorrhage and meningitis. If the spinal tap is okay and your neurologic exam's okay and you have a family history of migraines, very likely it's a migraine.
Okay. Do you have to do an MRI or a CT scan ever to determine what's going on?
Yes, the CT scan is done to exclude acute blood in the brain. That's the best way to quickly check for that. And MRIs are, they give us much more detail. Most of the literature says if the headache patient's neuroexamination is normal, you don't have to do any imaging. But most of us are a little more careful than that, and we have a low threshold for imaging in folks with headaches, especially if they're debilitating headaches.
Sure. How long? Is there such a thing as a normal length of a migraine, or how long can they go on?
They last anywhere from a couple of 2 to 4 hours to 3 or several days. And it depends on how effectively they're treated early on. If a migraine lasts, well, I tell patients that if they're in their second day, for sure their third day of a migraine, they have to come in and get treated with intravenous medications, because the oral medicines aren't going to touch it.
Well, let's talk about that. A person feels a migraine coming on. Are there over-the-counter medications that they can do, or just like maybe they haven't been diagnosed with migraines, maybe they just have these reoccurring bad headaches? What can you do on your own? And when do you recommend coming to see a doctor? Okay,
migraines can be treated in some folks effectively with aspirin or acetaminophen, and the nonsteroidal anti-inflammatory medicines like ibuprofen or naproxen. The brand names for those are Aleve and Motrin. I'm not endorsing any one product.
No.
And those sometimes help. What I like to use, and a few of my patients do this also, is either Coca-Cola or Pepsi-Cola with 3 or 4 tablets of ibuprofen, the 200 milligram, or 1 or 2 tablets of Aleve can often stop a migraine. The Coke or Pepsi would have caffeine, and this is really getting out there. I find that the diet, probably because of the aspartame, the diet colas don't do the trick.
Sure.
So that is quite effective in many of my migraines.
Well, that's good to know. That's good to know. Okay, so then maybe that's not working, or you're getting more migraines or headaches. So then you come to see a doctor, and obviously you interview them and find out what's going on and work them up. What treatments are available?
The class of medicines that we use now that have basically taken the migraines out of your mother's generation of migraines, so to speak, where they just had to go to bed and you had to be quiet,
right.
are a class of medications that we collectively call the triptans, and I'll refer to them by their brand names just because that's what most people are familiar with. I'm talking about medications like Imitrex and Maxalt and Relpax and Emerge. And these medicines work by restoring the level of serotonin activity in your brain. And they're quite effective, but what's very important with these medicines is that you take them, if you usually need them, it's very important that you take them as soon as you recognize your headache as a migraine. And many people with migraines, I haven't quite identified yet, it's almost like a smell, but it's a distinct perception that migraineurs have that this is a migraine, and they're aware of it before it forces them to go hide in a quiet, dark room, which we can talk about later.
You've talked about?
No, that's just the migraine itself. What that is it turns up. It's like there are pain receptors in the blood vessels of your brain, actually in most of your body, but in your brain. And in the course of the migraine, the sensitivity of those is turned way up. And before that happens, you become aware that that's going to happen. So as soon as you recognize your headache as, oh, I think I'm having another migraine, you use those medicines.
Uh-huh.
And those are the far and away most common class of medicines we use nowadays. There was a medicine that was a combination of meds called Migraine that we had several years ago, and it's still effective for several people, but it's not manufactured commercially anymore, although you can take it to a specialty pharmacy and have them compounded if it does the trick for you.
Oh, okay. So are these traditional medicines, or are there any new developments in that area?
Most of the new medicines for migraine, since the triptans include triptans in their formulation. Mm-hmm. So one that's come out in the past few years is a combination of sumatriptan or Imitrex plus I think it's naproxen or Aleve. So it's a combination of the triptan and one of the non-steroidal anti-inflammatories like ibuprofen or Aleve, which is a good combination, but I don't use it as much as I was hoping mm-hmm. I would.
Well, I think some people may be hesitant to take an ibuprofen with a medication mm-hmm. unless it's recommended. I mean, I certainly would question whether I should be taking something else if I've just taken one pill that's supposed to help.
I and many patients find that unless you're horribly nauseated, the non-steroidal anti-inflammatory meds are helpful in combination with the triptan medication.
I'm glad you mentioned nausea, because I know sometimes there are other symptoms besides your head.
Yes.
And you talked a little bit about the mood disorders and some of those things. What are some other symptoms?
Yeah, I'm glad you brought that up. The characteristics of a migraine headache are it can be on one side or both sides. The headache may start as an aching headache and then progresses fairly quickly over the course of several minutes to either a pounding headache, or some people experience that a constant exploding sensation in their head that becomes more and more compelling. This is associated with light and or sound sensitivity, and a lot of people have one being more disrupted than the other. Mild nausea to severe vomiting, occasionally even diarrhea. And this combination, this is very important for distinguishing a migraine or one of the other bad ones that we talked about earlier, is as opposed to a tension type headache, which can also have those components, a migraine characteristically compels somebody to seek a dark, quiet environment where they have no sensory stimulation. Mm-hmm. And that's what makes it a migraine and not a tension headache.
I see. Can these be harmful?
Very rarely. It's actually the aura component that is associated with, very rarely, strokes. Okay. And usually that occurs if an aura is persisting for several days. And usually, for several days, and they can have usually transient, that is, they don't last long, but occasionally permanent deficits, that is, abnormalities on a neurologic examination, usually weakness on one side of the body that, like I say, can be permanent, and these migraines are associated with a specific gene localization. That is, there's a gene that we blame these migraines called hemiplegic migraines on.
Easy for you to say.
Yeah, I know.
Okay, so they can be debilitating, they can be serious. So I guess advice to people is don't just deal with these, get some help.
Absolutely. If you have headaches of any kind that compel you to seek to go hide, or you have to go home. Mm-hmm. One, if they're migraines, we have very effective treatments for them. And two, you should be evaluated to make sure it's nothing more serious than a migraine.
Right. Well, good to know. I have a friend who has very serious migraines, and she often ends up in the emergency room. And in her words, they give her a shot.
Yes.
What would she be getting?
Now, most of the time in emergency rooms, they'll give you an opiate like morphine or Demerol,
Yeah, I think
plus
Demerol.
a medicine which is extremely effective for migraine and probably is more effective for your migraine than is the Demerol, and that's a medicine to treat the nausea.
Mm-hmm.
And that class of medicines are called the dopamine antagonists, that is, medicines that counteract the effects of dopamine in your nervous system. And this class of medicines is extremely effective against migraines, but we don't use them generally for migraines because they have some significant side effects, especially with long-term use. But if you go to the emergency room, one, you usually need hydration, because a lot of people with bad nausea can't even keep fluids down.
Right.
And so that's very important, and you're not going to feel better until they take care of that. And they usually, because people's headaches are so bad, they usually use the medicines like morphine and the dopamine agonist medicines, the anti-nausea medicines.
Yeah, well, that's pretty serious when people get to that point where they just can't function and show up in the emergency.
When they're at that stage, the migraine is very difficult to break, and I hope I said it earlier, probably the best way to effectively treat your migraine is treat it as soon as you recognize it as migraine. Do not wait until you have to go hide in the corner.
Right. Well, that's great advice, and I like that pure Coca-Cola, pure Pepsi versus a diet drink, and to start it off with ibuprofen or an anti-inflammatory type drug like that that can help.
I'm sorry. Yeah, and if you don't feel better in like a half an hour, you need to take use a more definitive treatment for your migraine. Now, I got to say, with the sugared Coke and Pepsi, diabetics need to be mindful of their blood sugar, and it's going to drive it up for a while.
Absolutely. But it is nice now and then to have a doctor say it's okay to have a real Coke or Pepsi.
Yeah, it's pretty unusual, isn't it?
Yeah. Well, thank you so much, Dr. O'Brien. We have run out of time. I think you lay the case very nicely for there is hope, there's treatment, there's probably not a cure, but there are ways to treat migraines. And thank you so much for sharing that knowledge.
Thank you for having me.